Hi, I'm Dr. Rob Liguori with Chiropractic and Sports Health. I'm here with Austin to talk to you about a condition that many tennis players may see. That's something called tennis elbow. That's the popular name. The actual name is called lateral epicondylitis. And what that is that's a condition where you start to develop some pain on the outside of your elbow. Often you'll see that with a gripping type movement or even just a lot of elbow bending. It's a pretty pesky type of injury, and we see a lot of this condition at our office. Basically what it is when it's an overuse injury that's related to a lot of sports. We do also see a lot of non-athletes who get it though too. They start to overuse their forearm, again with like gripping type movements. So they get a lot of strain through the muscles in the forearm here, and then those muscles come right up and they actually attach to the outside portion of that elbow at this tendinous point where it attaches to the bone. Essentially, that attachment point becomes very inflamed, so it creates a lot of recurrent, persistent pain in the area and doesn't really go away all that easily. So we do multiple therapies at our office for this condition, and the one I'm going to show you here today is one of the more common ones that I'll do for this problem. So if you'll just come in a little closer here now, what I'm going to do is work on the outside of Austin's elbow here. I use a little bit of lotion. I'm going to put that right over the skin. And then I have this tool here that I'm going to start working into that area of the elbow. So the whole point of this is ultimately to pull a lot of blood flow into that area where the tendon's injured. Tendons by nature have a pretty poor blood supply, which makes it very difficult for them to heal. So what I'm trying to do here is create a little bit of a reaction here with more blood flow, basically bring in a little bit of controlled inflammation, and that's going to really help to bring in the right nutrients to help it heal more effectively. So I'm going to work through this area in different directions as I go, maybe even get into these upper muscles too through the forearm. And usually this treatment for me, when I work on the patients with this, will last anywhere from about 3 to 5 minutes. And that's going to, right to the point where I start to see a good red reaction here. Sometimes there might be a little bruising depending on the person. More often it's not. It might be a little sore while we're doing this, but ultimately it's pretty comfortable to do. I'll often pair this too with a little bit of a stretch to the area afterwards, just to help it loosen up after it's gotten all warmed up. So again, this therapy is one that I'll do a lot. We get great results with it when we get some consistency with patients on doing this. So if you're dealing with this type of injury and it's something that sounds like it's resonating with you, don't hesitate to give us a call at our office.